Good afternoon. How are you? All good? Fantastic. All right. Then let's dive in. I'm Iain Langridge. I'm Vice President at MSCA, which is Samsung's Content and Services Division in North America. I run the lifestyle business, including health and fitness. All right, so this is not the right presentation, so we're going to wing it. All right, so work with me here. I want to thank you all for coming in this afternoon. We're on the health track, and we've got some pretty exciting things to show you this afternoon. So no postprandial snoozing allowed, and stick with me as we go through this. We got a number of speakers who've come in from outside the company, outside of Samsung, who are going to walk you through their experience in using the platform and working with it, and I think that will bring it to life. But before we do that, I want to take you through the platform itself and how it works. So I think it's perhaps unsurprising to anyone in this room that the global mobile healthcare market is exploding. More than 57%, that's more than 500 million smartphone users in 2015 will have accessed a healthcare application on their smartphone. And the vast majority of those interactions will be paid through a variety of models. It's certainly a vigorous mobile healthcare market that's evolving, and it's a fantastic opportunity for mobile solutions vendors to step into. The US healthcare market itself is worth $2.8 trillion, and that comes from medical and service fees and insurance premiums every single year. Of that massive cumulative spend, 71% is in hospitals, and 84% of that medical cost is into care services. And the top 5 chronic care issues, such as cardiovascular disease and diabetes, account for 40% of those costs. So that kind of scale, chronic care solutions, and prevention is a massive opportunity for everybody in this room. Today, Samsung Health, including the digital health platform and the S-Health application, well, they've really been focused on well-being and fitness. But in 2015, we're going to extend that, and we're going to focus on wellness and disease prevention. It's such a big issue. And working with our B2B and B2C partners, we're looking to start on collaborating on delivery of these services for 2015. So we're going to jump in and take a closer look at the Samsung Digital Health Platform. And because the world doesn't have enough acronyms, I'm very excited to announce that the new name of the Samsung Digital Health Platform is SDHP. And though the name is small, Samsung's ambition for this is very, very large. With our users agreement, we're really looking to provide an SDK that will aggregate all of their personal health record information in one application, then process it, filter it, analyze it, and store it securely. SDHP partners will have access to this structured data to use within their own care services and build their own businesses. But one of the key features of the digital health platform of SDHP is client-based data management. And that's got data encryption not just on the server side, but also in the client side. And that's essential because SDHP gathers PHR data from applications and sensors and partner applications and users' own manual inputs. So it's imperative that we provide the security around that, and that's now built into the system. But the SDHP platform also offers a built-in scoring and coaching system so that when users choose to store that data with us, we analyze it, we score it, and then we provide coaching on that user's health to improve it and to provide direct response to preventative care. One of the key features of Samsung's platform is that with this sort of client SDK and cloud-based data storage, we're able to share PHR data across applications freely. And because we've built in the security and encryption that's part of the platform, we're able to do that, and users are comfortable to store their data with us. But then with that sort of data, it's possible to then build the sort of services I talked about, the scoring and coaching services, the analytics functions that provide the sort of services that you can take and extend and develop into truly straightforward B2B and B2C value propositions that help build the whole ecosystem and the whole community. So I think our vision is really of an ecosystem with PHR data at the heart of it, with B2C and B2B partners working all around us, using that data, contributing to that data, leveraging it with safety and security to build a truly powerful portfolio of coordinated preventative care and wellness services. But that's enough from me. I could talk about this at length, but I think bringing it to life is far more important. So we've asked 3 of our closest partners to come in and to talk to you about what they've done with Smart Health, with SDHP, to bring it to life and show you what is possible. First of all, our partnership with Life Fitness is extraordinarily exciting. If you go out into the exhibition booth today, you'll see our connected fitness demo. And with the launch of the Galaxy Samsung S Note 4, we now have a capability to connect your smartphone to cardio equipment through our partnership with Life Fitness. In 2015, this will become available, but right now you can see the demo, like I said, and the way that it works is that as a user approaches a piece of cardio equipment, their workout profile is pulled from SDHP, given to the machine, and the machine is primed for their workout. During their workout, their data, their exercise data, is being fed back to them on their Galaxy Note 4, and then when they finish their workout, it's stored securely in the cloud as part of their PHR record, and is then available to be used and developed to provide the sort of coaching and healthcare services that are so important to preventative care. You're going to be hearing from Dan Wille on that. He's the VP of Business Development and Marketing at Life Fitness, and he'll be up here in a moment to talk you through more about connected fitness. Next up is Skimble. Skimble is an exercise and workout service that integrates with Samsung's Health SDK. I challenge you to try saying that fast 3 times. And here to tell you more about that will be Maria Lee. She's the CEO and co-founder of Skimble, and she's got to explain to me why I no longer have the excuse about not working out when I travel for business, because all my workouts can come with me. And lastly, you're going to hear from Chris Bergstrom. Chris Bergstrom is the Chief Strategy Officer at Welldoc. Welldoc focuses on chronic disease management. They use coaching and expert systems and decision support. And they've been working on developing an integrated diabetes application, which is available on all Samsung smartphones. So all these speakers are going to come up. They're going to run through their presentations and show you what they've been doing on Samsung's Smart Health platform, bring it to life for you, talk about their experiences, the best practices that they've established. And we'll start that without any further ado by calling up Dan Wille to the stage. So please welcome Dan Wille from Life Fitness. That's your control.
Thank you.
Fantastic.
Thank you very much, Ian. Learned 2 lessons from Ian just now. Number 1, understand what your co-presenters are presenting, because Ian just took all my thunder relative to what I'm about to present, but that's okay. I'll repeat it for you guys, and you can see what we're doing. I encourage you to go out to our booth and see what's going on, because it's better live. And secondly, in case your presentation isn't the one that's supposed to be there, always have a backup. Second lesson from Ian. So I'm going to get right into it. Life Fitness. My name's Dan Wille. I'm the Vice President of Marketing Product Development. I've been at Life Fitness for 20 years, and most recently, over the last number of years, we've moved into the technology space, more so than we've ever. We broke into the technology space, the first company with computerized electronic fitness equipment back in the early 70s, late 60s. I like to call it affectionately the red alarm clock piece of equipment that a lot of you probably are familiar with. But we wanted to get further into technology. We wanted to understand what people wanted from technology in their fitness workouts. And we did a study in 2011 to understand what was going on in this space. 72% of the people who work out said they want to use technology to create a better user experience for them while they're working out. Under 30, 76% of those people said, not only do I want to work out, but when I work out, I want to have access to my content, what I want to watch, my data, everything that has to do with me. That was profound for us and moved us into a space with a product we call Discover on our Elevation platform. Now, this goes all the way back. Our passion, Our founding passion comes from our founder, Augie Nieto, who always talked about the user experience, and there's two reasons why people leave exercise. Number one, they work out too hard, they burn out, have a bad experience, they're done. Number two, they don't exercise hard enough, they don't get results, and they leave. At the foundation, at its most basic level, we understand that that user experience has to be top-notch at its highest level. Moving into technology, that becomes even more important. So, user-curated experience. So not only do they want their movies, their music, their content, they want to customize their workouts, the workout that they run in their neighborhood or the traditional path that they use. They want to create the landscapes. They can do that now on the equipment. So we're evolving beyond just the red LEDs and the simple hill profiles. Now, the number one thing that we've learned is, and we've had this debate with some of our competition, as well as some of the people that we sell to, the data. Our belief is the data is owned by the individual, and the individual only. And what they do with that data is to create the best user experience for them and how they use that. We believe in this. We've launched a product called LF Open, which we've worked with Samsung on that product so they can pull that data and give it to their users of their products. So where does this take us, the adoption and moving into the future? What can we expect? Well, the first thing I can tell you is our industry, the fitness industry, the adoption is very, very low. It is not nearly as rapid as the consumer electronics industry. Some of my favorite stories, how many people work out? How many people work out at a club? Yep. A Planet, a Lifetime, and Anytime. If you work out at any of those, you'll be on our equipment, Life Fitness. And how many people walk in there and you start your piece of equipment and you have to look up and pick one of 5 TVs and watch whatever they have playing? Well, that's not getting your experience. One of the examples I use is my son, who's 12 years old, lives in a world and expects things to work a certain way, and that's going to become more profound for him as he gets older and older. The example I use on my Levino laptop, I was pointing something out to him several months ago, and he said, "Dad, all you need to do is go over here. You see that over there?" And I said, "Mason, I can't see that. What are you talking about?" And he said, "Just right over there. You need to go over there." And he got frustrated and came over, took his 2 fingers, and tried to pinch my Levino laptop to shrink the screen. Didn't work. The point is, his expectation of how technology is going to work is profoundly different than the generations before him. So he wants to get his phone, his content, as the statistics say in our research, on that product, and he wants to get that data and use that data to benefit him moving forward. So the future. In 2012, when we launched Discover Elevation product, we saw this trend coming, but didn't necessarily know how to deploy it, what to do. We embedded Bluetooth technology on all of our products shipping on the Elevation line, not knowing how we were going to use it. We played with Bluetooth headphones, Bluetooth speakers. Really, the user experience on any of those isn't what you would expect or what you would want in a club. Then along enters Samsung. And they came along, and through a partnership and through our LF Open API integration, we worked with them feverishly to come up with the product that Iain was talking about. Walk right up to any piece of Life Fitness Elevation equipment. It recognizes your phone, logs you in, and preloads all of your data, all of your pre-programmed workouts. You can start your workout. In real time, it tracks that data right into your device, and you can change the piece of equipment from a resistance standpoint as well as other attributes. That then gets captured for the individual in the Samsung device and gets held there, as Iain explained in his opening presentation. Just the very beginning and very powerful of where we can go with this, with our LF Open API, and really proud that we were able to step forward with Samsung and put this together. I encourage you to come over to our booth 303 right behind you, and see it in live action, and explore some of the other options and things that you can do with LF Open, and we'll answer any of your questions relative to Life Fitness or where we think connected fitness is going to go in the future. So with that, I'll hand it over to Maria at Skimble.
Thank you. Good afternoon, everyone. Just for starters, don't let the blazer fool you. I am a fitness fanatic. All my friends say so, so I think I'm qualified for this talk. Just to give you a bit of background, my name is Maria. I'm the co-founder and CEO of Skimble, and we make health and fitness applications based in San Francisco. And let me talk to you today about our partnership with Samsung, and specifically with their S-Health platform. I think we can all agree that most people want to live well and be fit, but it's not always easy. People often lack guidance, motivation, and constantly feel like life itself gets in the way. Thankfully, with the proliferation of mobile devices, we have now an incredible opportunity to overcome the obstacles commonly faced by people when trying to live actively. And we can do this in a very connected and transformative way. Let's take a step back and think about the digital health space. As you guys probably know, Samsung is a top device manufacturer. And not only that, they were the first of its kind to launch a publicly available health aggregator. For us at Skimble, we're pretty intrigued by this as a developer with our flagship application, and what we could do to tap into this ecosystem to provide a more holistic and personal experience for the end user. So let me give you a little bit of information about us. We strive to empower people to live a healthy and active lifestyle, and we do that through a mobile wellness platform of fun and dynamic coaching applications for everyone. And I mean that. So whether you're just getting off the couch, sitting there today, just enjoying all the different sessions at the conference, or cross-training for the sports that you love, we have workouts for you. And speaking of which, this is our flagship application, Workout Trainer, and it provides thousands of multimedia workouts and custom training programs led by expert coaches. We have been able to grow organically to become a top health and fitness application on Android. You can find us on Galaxy apps and Google Play. And at a glance, you can see that it's a beautiful application. And it takes the user through a very personalized fitness experience. And from us understanding their wellness goals, we can provide custom recommendations and workouts that fit within their busy lifestyle. Think of it as kind of a move-by-move directions to living actively. In addition, what we do is we collaborate with a network of personal trainers and health coaches to create fresh content for our over 15 million users. All right, so let me share with you a few fun facts. Over 95% of our users want to live actively and work out over 3 times a week. Whether they can get there is, a relationship between us and, their personal motivation. And we're working towards helping them achieve their goals on a weekly basis. In addition, nearly half of our users opt in to having us remind them to be active and achieve their goals. In terms of some of the top workouts that we serve for our community, a lot of them are quick, high-intensity based workouts that you can do literally anywhere. A lot of them include and incorporate body weight exercises. And you can see from the graph, people are exercising and completing workouts on a weekly basis. And for Skimblers, the power hour appears to be 9 p.m. Okay, so now that I've covered a little bit about us, let's talk about the digital health space and what Samsung is doing with their S-Health platform. You guys may have seen what it looks like. This is the S-Health application. You can find it on your Samsung devices. And for developers, this is the S-Health Service SDK, where it's pretty much broken down into 2 components, the client and the server SDK. What we did was focus on the client SDK, and we tapped into the ability to share read and write information for our workouts. So, for everyone else, you can tap into the biometric, exercise, and food data. In terms of our integration, you can see within the S-Health application that the ability to see your exercise log is available, as well as partner apps, so an opportunity for discovery as well. So we had a great experience partnering with Samsung as a launch partner, and if you're new to the platform, I just wanted to share a few tips and tricks. For starters, think about the different form factors that you want to develop on, and I recommend you getting them all. So for us, we have a beautiful experience on all of the latest smartphones in terms of the phones, the tablets, and we wanted to get all of those devices to make sure that it was a beautiful experience on those top devices. And now, one thing that is kind of surprising, I'm a Mac user, but I think it's important to use both different platforms. So in terms of the PC, I throw that up there because there are some tools, some partner tools that required me to access on a PC. I'm serious. And then in terms of active communication, I think it goes without saying, to be a great partner is to provide regular feedback, and you're working towards similar goals, so together you can reach timely targets. And of course, it's a great feeling when you can experience the success of the application and the platform, and to celebrate together like we are here at the Samsung Developer Conference. Okay, so as you guys probably know, Samsung isn't new to providing developers with tools and SDKs. So on top of us working on and with the S-Health SDK, we also used some of their other tools, such as Galaxy Gifts, Gifts redemption process, the Galaxy Apps Marketplace, and Samsung Account API, or SDK, sorry. So on the discovery side, on all of the latest Samsung devices, users can download applications through Galaxy Apps. And through there, you can check out some of the gifts that are offered for select devices. So with Workout Trainer, we were able to provide a pro membership for new users signed up from select devices. And very quickly, it's a very seamless process where people download the application, go through sign up, immediately and seamlessly activate their Pro Plus membership, and enjoy the premium experience of the application. In terms of Galaxy apps, this is where you will publish, submit, publish, and update your application. It's your digital storefront, and I just recommend adhering to the guidelines and making time so that you are able to go through the review process and launch when you intend to. So now quickly, for the Samsung Account SDK or API, we also connected with it for Workout Trainer, and it's actually required for S-Health. So it's nice because users, there's a great mechanism so that our users could log in, sign up through Samsung accounts. And in thinking about how important it is for users to have their data and being able to disconnect and connect is an important thing, and it's highly recommended as well for all developers. I often get asked, how do you build a top app, a bestseller in the health and fitness space? And of course, it's kind of a loaded question, and I could go on quite a bit, but I just wanted to share a couple of things, or three, that I'd like you to keep in mind. So in terms of the product strategy, maybe you can ask yourself, who is the customer that you're building for? And how are you going to help them with their core challenges, and doing it in a sophisticated way through leveraging technology? Do you have a clear value proposition, and are you able to prioritize so that you can put your best guesses forward and also have a feedback loop so that you are providing tools for users that are actually using your product? Gone are the days where you can just develop an app over the weekend and just submit it and have 1 million downloads. I think one of the big things that you should keep in mind as a developer is the design component of the entire process. So this happens very early on with us. When we worked on the application, we did a beautiful redesign. And in thinking about it, if you're developing from the ground up, keep in mind what kind of experience, what visual language you will use to really promote your product and also elevate the entire experience. And finally, just a little light touch on the technical architecture. So, of course, everyone in this room probably is a developer or has developed at some point in the past. And there is always sort of this compromise where you want to develop a very elegant, robust, and scalable solution, but you also have to keep in mind, your timing constraints and also tap into the different tools that are out there so that you can really leverage them and build a great product. There are plenty of other aspects that you would want to keep in mind. And I think just generally, the all things considered mentality would be a good thing as you're just getting started. All right, so let's wrap it up. The Samsung developer ecosystem is focused on the digital health space now more than ever. And you are able to tap into a plethora of data and to use that to create compelling, useful, and actionable baby steps to help make this world a better place. From our experience working with Samsung, we've learned a lot of lessons, and it's been great as a trusted partner. One of the things that I haven't mentioned before, but I think it's important now more than ever, is to make sure that you're providing a solution that's timely. We were one of the first ones to market, and of course, with me, I was developing a solution for myself, and then for my friends and the people that I help coach or just wanted to live more actively. So providing kind of that heads-up guidance with a vision that you believe is useful, but also that makes a lot of sense for everyone else. So you're not just developing for yourself, but you're developing for a mass audience. Team is critical. We have a very entrepreneurial team, and we're rapidly prototyping based on our instincts and then as well the data. And of course, and very importantly, to have empathy for your users and to develop the relationships that they provide within your application or through different experiences in person where you're dealing with and working with people that you're serving, your customers, your partners, all of it. And of course, I like to be mindful to never stop innovating. So if you're new to the S-Health platform, I encourage you to check out the developer.samsung.com health. It's their new website. That'll give you all the steps to getting started. And lastly, I'll leave you with this. The health and fitness app usage has outpaced the entire app market, 87%. This is some statistic launched or released recently by Flurry Analytics. And I think there doesn't show to be, there isn't an end to it. Today, the devices and the developers are here quite literally in this room, and both are just going to get better. And more than ever, consumer adoption and awareness for technology products that can enable them to live a more active, healthier lifestyle are here, and it's reached a critical mass. So, of course, I encourage you to get started with this, and together we can create solutions that are meaningful and work together in the ecosystem. That's it. Thank you, and I will hand it over to Welldoc.
Hello, I'm excited to be here. I've been working in healthcare for 17 years, and I've never in that career seen a time like we have today where the world's changing incredibly rapidly. The potential and change occurring in healthcare today is like something we've never seen before. And let's be honest, it's a very old, stodgy industry, right? So this is an exciting time, and it couldn't have come a moment too soon. Let's focus on one of the greatest challenges facing our modern day history, diabetes. Today, there's nearly 400 million people in the world suffering from diabetes. In the United States alone, 29 million people, costing our nation every single year $265 billion and growing. To put that into perspective, if you were to take Samsung's US revenues, right, this is a big company, you'd have to multiply them by 5 just to barely cover that tab. So it's an epidemic that we have to address from any perspective you look at it. The problem is, diabetes is a very daunting disease to manage. The reason why is because it requires daily self-management across many attributes. Patients have to do med management, symptom management, lifestyle management, glucose management, diet, exercise. All of this plays into taking care of your diabetes. Yet patients get just a few minutes a year with their healthcare provider to help them learn how to do this. So how do we help them? Well, today, best case, we say, here's a bunch of data, good luck. We don't help them understand how to use that data, and it's only getting worse. As the population grows with diabetes, patients are having less and less time and support from their healthcare providers. So what if we could change all that? What if we could flip the paradigm on its head? What if we could, instead of deliver data or leave a patient hanging, we could give them the knowledge, the actionable knowledge, the information they need in the moment that they need it, personalized to them, personalized to each one of you if you had diabetes. And you could get it anywhere, anytime. Well, today that's possible. The world's first mobile prescription therapy is now here. This is Blue Star. Blue Star is FDA cleared, recognized by the American Diabetes Association as a new first-in-class therapy. It's been through randomized controlled trials with published positive clinical outcomes. It's been shown to reduce some of these very costly hospital and ER events that are driving our nation's healthcare tab. And it requires a prescription from a patient's doctor. And it's reimbursable through the patient's pharmacy insurance. So think about that. A digital solution that must legally be prescribed by a patient's doctor and is dispensed through the pharmacy. What's really neat about that, number one, patients say, I want to get healthcare products and services from my physician. I still trust my physician. And I want to know that these are medically sound products that I'm using. Also, from that very moment in time that it's prescribed, we're beginning that physician-patient care coordination process. Essentially, what Blue Star does as a prescribed product is it's extending the physician's care and treatment beyond the 4 walls of their office into the patient's life 365 days a year so that they can finally have the support they need when they need it. So what exactly is it doing? So Blue Star is providing for patients real-time, personalized, contextually relevant, 24/7 coaching. This is all automated. And for the physician, we're providing them knowledge that allows them to optimize their treatment plan for their patient at the moment that they're actually making the decision, sitting there with the patient in their office visit. So what might that look like? Take a patient with diabetes. They might be having a hypoglycemic episode, meaning their glucose is very low, their blood sugar is very low. This can be very dangerous. If they're driving a car, they could pass out. They could end up in the hospital or the ER. It could even lead to death. So what if instead of saying, hey, your glucose is low, here's the number, we could say, here's what you need to do about it right now. Here's how we can treat this critical low. Here's how we can get you out of the danger zone. Or what if we could give actionable education and knowledge at another moment in time? Hey, Bill, you're going to bed right now. This would be a great time to do a glucose check. But also, very importantly, please check again in the morning when you wake up. This is called structured smart testing. And it allows us to understand the cause and effect of something like sleep on a patient's glucose. And that can inform the algorithms that are driving this product, the patient's physician, or even the patient. Or we could support them in their medication management. And not just saying, hey, time to take your meds, because we all know that doesn't work, but time to take your meds, and here's exactly what you should be taking. Matter of fact, we've calculated the dosage according to your physician's orders, and we can even teach you about these medications at that moment in time where you're taking them. Because how many times have people tried to teach us something where we're really not dealing with that particular item? Maybe that was 4 months ago. But if someone tells you about something in the moment that you're actually dealing with it, like I'm taking my med, you're very open to learning about that at that particular time. Then for their physician, when the patient goes back to see their doctor, let's say every 90 days, and they go in to see their physician, today the traditional conversation goes like this. So we haven't seen each other in 90 days. What's been happening? Well, I wasn't feeling very good about 4 Thursdays ago. Oh, well, what did you do? What were you eating? And then did you check your glucose? What was the number? And then did you take your medication? And then what was your glucose level? If I asked you what you had for dinner 3 Thursdays ago, or what you're doing when you last had a headache, it's probably a very difficult conversation for us to have. Same thing here between patient and physician. So instead, what can we do? What if we could provide a doctor a very simple report that says, here's what your patient's been struggling with, but more importantly, we know you're a very busy general practitioner, and we're just going to cut to the chase, and here's what you need to do about it. Maybe this patient's glucose targets need to be changed. Maybe they need to be put on a statin. Maybe they're overdue for a foot exam or an eye exam, or their mealtime insulin needs to be titrated. You're the physician, you make the decisions. We wanted to offload that analysis, put it right at your fingertips, all according to evidence-based guidelines. And then you can optimize the patient's treatment plan. It's that coordination of care that then extends back into the patient's daily life. And we do it in a way that fits into the patient's life across any of their devices, their phones, their tablets, their computers. They can bounce back and forth. We see some people use just computers, some people just phones, some a mix of both, just like we do with our email and other products that we use on these devices. It also works on EMRs for the physician, and believe it or not, fax machines, because that's still very important in healthcare. This product, Blue Star, is also wrapped in an end-to-end service delivery to help everyone in the ecosystem. So for the physician, we're out there face-to-face, training the physician. Here's what Blue Star is. Here's what you need to know about it. Here's how you can fit it into your practice. And most importantly, here's who it's appropriate for. It has an FDA indication for use for adults with type 2 diabetes. And let's talk about within that population who you might think is appropriate for, so you can prescribe it when medically needed. And then for the patient, how can we help them get started to make sure that they know the power of this product, how to use Blue Star, and then how to fit it into their daily diabetes management routine. And then if the patient or the physician have any questions, they're not calling their health plan, they're not calling Samsung, they can call Blue Star Customer Care, and Welldoc can help them with any concerns or questions that they may have. You may have heard this morning during the keynote, Samsung has selected Welldoc as one of their key healthcare partners, and we're very excited about this. This is going to be a fascinating multi-stage relationship where we're going to leverage the power of 2 unique healthcare platforms, the Samsung Digital Health Platform and the Welldoc Clinical and Behavioral Science Expert System. And together, we can do things that are going to help people with diabetes around the world that otherwise couldn't have been done. So thank you very much.
Brief recap. I wanted to thank Chris and the other speakers from this afternoon. But today, in this session, we ran through Samsung's SDHP platform. We introduced it to you and our vision for it, of the ecosystem of partnerships, storing secure PHR data, and then leveraging that data to build successful wellness and preventative care solutions together. From Dan at Life Fitness, I think you got an example of what happens when we collaborate together with the SDHP and Samsung, Life Fitness, coming together to build bold, creative, and innovative solutions that look great. And if you go out to the booth and try it, you'll see feel great, they resonate, and they're really innovative experiences. Maria gave us a great case study on how to work on the SDHP, how to use it, make the most from it, and work their way through Samsung and deliver a great experience that makes a successful business. And then last from Chris, you heard about the fact that a boundless ambition and a creative approach can make a real difference and really bring a phenomenal business to marketplace that leverages and uses the benefits of this shared and stored PHR data. So it just remains for me once more to say, if you have any specific questions, there is a technical session tomorrow between 10 and 11. That's Thursday between 10 and 11. And all of the issues around the client SDK and the platform itself will be up for discussion, and we can answer all your questions there. I'd like to say thank you to Maria, to Dan, to Chris one more time. I'd like to say thank you very much for coming to the session on the Samsung SDHP platform and ecosystem. Thank you very much, and have a great afternoon.